Now, today's topic is interpretation of cardiac abnormalities by a vectorial analysis of the heart. Now, this is the recording of the normal ECG, and as we know, the normal ECG has this is the P wave, QRS complex, and the T wave. P wave denotes atrial depolarization. QRS complex shows the ventricular depolarization, and this is the T wave which shows the ventricular repolarization wave. Now, so this is the normal ECG, and when the heart is diseased or when there is some problem with the cardiac tissue or with the conduction of the impulse in the heart, there is change in the ECG recording, and that can be traced with the help of the vectorial analysis. Now, vectorial analysis of the diseased heart. Most serious abnormalities of the heart muscles can be diagnosed by analyzing the contours of the waves in different electrocardiographic leads. The preponderant direction of the potential during depolarization is called mean electrical axis of the ventricle. The mean electrical axis of the normal ventricle is 59 degrees. In many pathological conditions of the heart, this direction changes markedly, sometimes even to opposite poles of the heart. In any part of the recording, if it is negative, this negative potential is subtracted from the positive part of the potential to determine the net potential of that particular lead. Now, let us come to this recording. This is the recording in lead 1. This is the recording in lead 3. If these two recordings are available, we should draw perpendicular from the arrowhead of lead 3 and from lead 1 and the point of intersection. From there we can draw the straight line up to this point. This is actually mean electrical axis, and this is around 59 degree in this case. So, mean electrical axis of the ventricle averages about 59 degrees. A number of abnormal conditions of the heart can cause axis deviation beyond the normal limits. If the heart is angulated to the left, the mean electrical axis of the heart also shifts to the left. Such shifts occur at the end of deep expiration or when a person lies down because the abdominal contents press upwards against the diaphragm, and it is quite frequently observed in the obese people whose diaphragms normally press upwards against the heart because of obesity. Now, angulation of the heart to right causes the mean electrical axis of the ventricles to shift to the right, and this occurs at the end of the inspiration in normal cases, and in some cases when a person stands up, and it is most common in tall people whose heart hang downwards. So these are the normal cases where this occurs, but in disease condition where it occurs, that we'll see. Next slide. So, hypertrophy of one of the ventricle. When one ventricle greatly hypertrophies, the axis of the heart shifts towards the hypertrophied ventricle because of the two reasons. First, a great quantity of the muscles exist on the hypertrophied side of the heart than on the other side, which allows generation of the greater electrical potential on that particular side. So, in the hypertrophied side of the heart, the mass of the heart tissue grows, and because of this, it allows generation of greater electrical potential on that side. Second, more time is required for the depolarization waves to travel through the hypertrophied ventricle because there is increased mass than through the normal ventricle. So, the cardiac impulse takes longer time to pass through the hypertrophied ventricle in comparison to that of the normal ventricle. So, the normal ventricle becomes depolarized considerably in advance of the hypertrophied ventricle. This situation causes a strong vector from the normal side of the heart towards the hypertrophied side. Thus, the axis deviates towards the hypertrophied ventricle because hypertrophied ventricle has larger mass of muscles, cardiac muscles, and it takes the depolarization waves takes longer time to pass through it. So most of the time it is positive in comparison to the other the um, the other ventricle, which is depolarized soon. So the vector is directed towards the hypertrophied ventricle. Now, left axis deviation can also occur when there is bundle branch block. Bundle, bundle branch block also cause axis deviation. Ordinarily, the lateral walls of the two ventricles depolarize almost at the same instant because the left and right bundle branches of the Purkinje system transmits the cardiac impulse to ventricles at the same instant. If one of the major bundle branch is blocked, the cardiac impulse spreads through the normal ventricle long before it spreads to the other ventricle. As a result, axis deviation occurs, and when the left bundle branch is blocked, the deviation is towards the left side because when the left bundle branch is blocked, the left side of the ventricle takes longer time to depolarize, and it remains positive for longer time. So the direction of the vector is towards the left. So and left, and there is deviation of the mean electrical axis to the left. This can be seen here in this case. This is the recording of the lead 1. This is recording of the lead 3. And if we draw the perpendicular and join at this point, at the point of intersection up to this point of a line is drawn. This shows the mean electrical axis, and here the recording is towards the minus because of the obstruction. So here again the mean electrical axis, which should be in this direction, is in the opposite direction, and it indicates the slow depolarization of the left ventricle because of the obstruction in the left bundle branch. Now, right axis deviation. When the right bundle branch is blocked, the left ventricle depolarizes far more rapidly than the right ventricle, and thus the left side of the ventricle becomes electronegative as long as 0.1 second before the right side. Therefore, a strong vector develops with its negative end towards the left ventricle and positive end towards the right ventricle. Thus, intense right axis deviation occurs, and this is the case. So, what happens if the right ventricle there is hypertrophy in the right ventricle? Then what happens? The axis is deviated towards the right side because there is increased in the muscle mass of the ventricle, right ventricle, resulting into longer time of it takes long time to get depolarized, and it remains positive for longer time. That is why the mean electrical axis deviate towards the right side, and this is the case. So here again the recording is negative. This is lead 3, lead 1, and if we join, this is the recording of the lead. This is the direction of the mean electrical axis. Now, abnormal voltages. So the second case is, so till now we have studied what happens when there is increased mass in either left ventricle or right ventricle, or the deviation may also occur when there is obstruction in the conduction of the impulse through the left bundle branch or the right bundle branch. Now let us come to second case, when there is abnormal voltages of the QRS complex. Now increased voltage 1, when the sum of the voltages of all the QRS complexes of the 3 standard lead is greater than 4 millivolt, the patient is considered to have high voltage ECG. That is, if we summate the voltages of the QRS complex of the 3 standard leads, and if the summation product is more than 4 millivolt, then the ECG is supposed to be high voltage ECG. Now, cause of high voltage QRS complex is increased muscle mass of the heart, which is due to resultant of the hypertrophy of the muscle. So, increased voltage is seen in the case of hypertrophy of the muscle, and this is the recording of the high voltage ECG. Now, this is lead 1 recording, lead 3, and the perpendicular is drawn, and this is the mean electrical axis. The voltage of mean electrical axis is too long or it's too high, and this is known as the high voltage QRS complex or high voltage ECG. Now, decreased voltage of ECG. Decreased voltage of QRS complex is due to a series of old myocardial infarctions with diminished muscle mass. Whenever a person has several heart attacks, some of the cardiac tissue is lost, resulting into diminished cardiac muscle mass. This condition causes the depolarization wave to move to the ventricle slowly and prevents major portion of the heart from becoming massively depolarized all at once. This condition causes prolonged QRS complex along with decreased voltage, and this is the case. Here we can see the voltage is decreased, and this is resultant of when the cardiac tissue is already diseased, maybe because of repeated heart attacks or some other cardiac disease. Now, current of injury. Many different cardiac abnormalities, especially those damaging heart muscles, often cause part of the heart to remain partially or totally depolarized all the time. In this condition, current flows between the pathologically depolarized and the normally polarized areas, even between the heartbeats, and this is called current of injury. So what happens if some of the part of the cardiac tissue is damaged, there is it that area becomes totally depolarized for all the time. So there is always flow of current between this depolarized area and the polarized area of the heart. So in this condition, current flows between the pathologically depolarized, which is actually negatively charged, and normally polarized area, even between the heartbeats. This is called current of injury. The injured part of the heart is negative because this is the part that is depolarized and emits negative charges into the surrounding fluids, whereas the remainder of the heart is neutral or having positive polarity. So this is the recording. Suppose this is the injured area. So this remains negatively charged. So now the vector will be from negative to positive end. So direction of the vector will be this, from this to this. Injured area is always negatively charged. So direction of the vector changes and it is opposite. And this can be recorded in all the three leads like this, lead 1, 2, 3, and this is known as current of injury. Now, cardiac arrhythmias. Tachycardia means fast heart rate. When the heart rate is faster than 100 beats per minute, it is known as tachycardia. The ECG is normal except the heart rate is about 150 beats per minute. Now this is the recording of the tachycardia. You can see the number of beats per minute is increased. Now what happens in bradycardia? It means a slow heart rate around 60 beats per minute. The normal is 70 to 80 beats per minute. So in the case of tachycardia, it is around 150 beats per minute, and in the case of bradycardia, it is 60 beats per minute. And it happens in several cases and most of the time in athletes due to heart size larger and stronger than the normal person. And it allows the athlete heart to pump a larger stroke volume output per beat even during the periods of rest. So here the size of the heart is increased, and so the stroke volume per stroke per beat is increased. And so heart beats at slower rate around 60 beats per minute. Fibrillation, flutter, and cardiac arrest. Ventricular fibrillation results from the cardiac impulses that have gone berserk within the ventricular muscle. Mass stimulation. First, one portion of the ventricular muscle stimulates, then another portion. There is never coordinated contraction of all ventricular muscle mass at once, which is actually required for pumping cycle of the heart. So various parts of the heart contract at different timings, resulting into there isn't any efficient contraction of the heart. Now, in contraction of the ventricle. Similarly, in the case of atrial fibrillation, phenomena is same as ventricular fibrillation. It is restricted to atria as atria is separated from ventricle by fibrous tissue. There is impaired pumping of atria during atrial fibrillation. Now, third case is that of cardiac arrest. It occurs due to cessation of all electrical control system in the heart. That is, no spontaneous rhythm remains, and this may lead to death. So, thus we see that various cardiac abnormalities can be detected by the help of the vectorial analysis.